In this section, we will understand equations of renal clearance, renal blood flow, and glomerular filtration rate. First is the renal clearance. Clearance indicates the volume of plasma cleared of a substance per unit time. The units of clearance are milliliter per minute or milliliter per 24-hour. Now, let's discuss equation of clearance. C is equal to U into V divided by P. What are U, V, and P in equation? Well, C is clearance, and its units are milliliter per minute or milliliter per 24-hour. U is urine concentration. Its unit is milligram per milliliter. V is urine volume per time. Its unit is milliliter per minute. P is plasma concentration. Its unit is milligram per milliliter. Now, let me give you a clinical case. Are you able to solve it? Miss Diana is a patient. Her report shows that the plasma sodium is 140 milliequivalent per liter. The urine sodium is 700 milliequivalent per liter. And the urine flow rate is 1 milliliter per minute. So are you able to find out what is the clearance of sodium using the equation of clearance? As we have already discussed, the equation of clearance. Putting the values in the equation. The urine sodium is 700 milliequivalent per liter. The urine flow rate is 1 milliliter per minute. And plasma sodium is 140 milliequivalent per liter. Now these units are same, so they cancel each other. In next step, 140, one's the 140. And 140, five's the 700. In next step, 5 into 1 is 5. So, the clearance of sodium is 5 milliliter per minute. Moving towards renal blood flow. Renal blood flow is 25% of the cardiac output. Renal blood flow is directly proportional to the pressure difference between the renal artery and the renal vein, and is inversely proportional to the resistance of the renal vasculature. Vasoconstriction of renal arterioles, which leads to a decrease in renal blood flow, is produced by activation of the sympathetic nervous system and angiotensin II. Angiotensin I converts to angiotensin II through angiotensin-converting enzyme. At low concentrations, angiotensin II preferentially constricts efferent arterioles, thereby protecting, through increasing the glomerular filtration rate. Angiotensin-converting enzyme, or ACE inhibitors, dilate efferent arterioles and produce a decrease in glomerular filtration rate. These drugs reduce hyperfiltration and the occurrence of diabetic nephropathy in patients of diabetes mellitus. Vasodilation of renal arterioles, which leads to an increase in renal blood flow, is produced by prostaglandins E2 and prostaglandins I2, pradikinin, nitric oxide, and dopamine. Atrial natriuretic peptide, or ANP, causes vasodilation of afferent arterioles and, to a lesser extent, vasoconstriction of efferent arterioles. Overall, atrial natriuretic peptide, or ANP, increases renal blood flow. It has already been discussed. First point of discussion in renal blood flow is autoregulation. Autoregulation of renal blood flow is accomplished by changing renal vascular resistance. If arterial pressure changes, a proportional change occurs in renal vascular resistance to maintain a constant renal blood flow. Renal blood flow remains constant over the range of arterial pressures from 80 to 200 milliliter of mercury through autoregulation. The mechanisms for autoregulation include myogenic mechanism, in which the renal afferent arterioles contract in response to stretch. Thus, increased renal arterial pressure stretches the arterioles, which contract, and increased resistance to maintain constant blood flow. Second is tubulo-glomerular feedback, in which increased renal arterial pressure leads to increased delivery of fluid to the macula densa. The macula densa senses the increased load and causes constriction of the nearby afferent arteriole, increasing resistance to maintain constant blood flow. These are already being discussed in this video in detail. Second point we need to discuss under renal blood flow is measurement of renal plasma flow, or RBF, through the clearance of para-aminohippuric acid, or PAH. Para-aminohippuric acid is filtered and secreted by the renal tubules. Clearance of para-aminohippuric acid is used to measure renal plasma flow. Clearance of para-aminohippuric acid measures effective RBF and underestimates true plasma flow by 10%. Clearance of para-aminohippuric acid does not measure renal plasma flow to regions of the kidney that do not filter and secrete para-aminohippuric acid, such as adipose tissue. Moving towards its equation. Renal plasma flow, or RBF, through the clearance of para-aminohippuric acid equals to U into V divided by P. This is the clearance of para-aminohippuric acid. Its unit is milliliter per minute or milliliter per 24 hour. RBF is renal plasma flow. Its unit is milliliter per minute or milliliter per 24 hours. This is the urine concentration of para-aminohippuric acid. Its unit is milligram per milliliter. V is the urine flow rate. Its unit is milliliter per minute or milliliter per 24 hours. This is the plasma concentration of para-aminohippuric acid. Its unit is milligram per milliliter. Third is the measurement of renal blood flow. Renal blood flow is equal to renal plasma flow divided by 1 minus hematocrit. The denominator in this equation, 1 minus hematocrit, is the fraction of blood volume occupied by plasma. Now moving towards the glomerular filtration rate. In this topic, we will discuss the measurement of glomerular filtration rate through the clearance of inulin. Inulin is filtered, but not reabsorbed or secreted by the renal tubules. The clearance of inulin is used to measure glomerular filtration rate. Glomerular filtration rate equals to U into V divided by P, where GFR is glomerular filtration rate. Its unit is milliliter per minute or milliliter per 24 hour. This indicates the urine concentration of inulin. Its unit is milligram per milliliter. V is the urine flow rate. Its unit is milliliter per minute or milliliter per 24 hour. This is the plasma concentration of inulin. Its unit is milligram per milliliter. Let's understand it through example of calculation of glomerular filtration rate using this equation. Inulin is infused in a patient to achieve a steady-state plasma concentration of 1 milligram per milliliter. A urine sample collected during 1 hour has a volume of 60 milliliter, and an inulin concentration of urine is 120 milligram per milliliter. What is the patient's glomerular filtration rate? Let's make it simple. Urine flow rate is 60 milliliters per hour. Now in next step, 60 milliliters divided by 60 minutes, as 1 hour is equal to 60 minutes. 60 once the 60, and 60 once the 60. So urine flow rate becomes 1 milliliter per minute. Now, what is the patient's glomerular filtration rate? Glomerular filtration rate equals to U into V divided by P. Now putting the values in the equation. Inulin concentration of urine is 120 mg per milliliter. Urine flow rate is 1 milliliter per minute. Plasma concentration is 1 milligram per milliliter. These units are same, so they cancel each other. So 120 into 1 is equals to 120. And 120 divided by 1 equals to 120. So, patient's glomerular filtration rate is 120 milliliter per minute. Second important point we need to discuss under glomerular filtration rate is the estimates of glomerular filtration rate with blood, urea, nitrogen, or BUN, and serum creatinine. Both blood, urea, nitrogen, or BUN, and serum creatinine increase when glomerular filtration rate decreases. In prerenal azotemia, in which there is hypovolemia, means low blood volume, BUN increases more than serum creatinine, and there is an increased blood, urea, nitrogen, or BUN creatinine ratio, which is greater than 20:1. Glomerular filtration rate decreases with age, although serum creatinine remains constant because of decreased muscle mass. Third important point of discussion under glomerular filtration rate is filtration fraction. Filtration fraction is the fraction of renal plasma flow filtered across the glomerular capillaries. The equation of filtration fraction is already been discussed in this video. Filtration fraction is equals to glomerular filtration rate divided by renal plasma flow. Filtration fraction is normally about 0.20. Thus, 20% of the renal plasma flow is filtered. The remaining 80% leaves the glomerular capillaries by the efferent arterioles and becomes the peritubular capillary circulation. In one situation in which increases in the filtration fraction produce increases in the protein concentration of peritubular capillary blood, which leads to increased reabsorption in the proximal tubule. In other situation, decreases in the filtration fraction produce decreases in the protein concentration of peritubular capillary blood and decreased reabsorption in the proximal tubule. Fourth point of discussion is the determining glomerular filtration rate through the Starling forces, which are the driving force for glomerular filtration is the net ultrafiltration pressure across the glomerular capillaries. Filtration is always favored in glomerular capillaries because the net ultrafiltration pressure always favors the movement of fluid out of the capillaries. This has already been discussed in detail in this video. This was all about renal filtration.